Hello YouTube family, and this month we're going to talk about one common condition that a lot of people are suffering from is called cataract. Cataract is a common issue. Cataract is basically almost, if we live long enough, everyone will suffer from the condition of cataract. Each year in the US is about 4 million cataract surgeries performed. Most patients have great outcome out of it. I would say, even say 99% of the time, patients will have great outcome. Very few that may have some complication because of the sophistications of the cataract surgery. What is cataract? Cataract is actually a clouding of the eye's natural crystalline lens. When you're looking at the picture right here, you can see the front layer of the eye is called the cornea, and then you can see there is the iris. Right behind the iris is where the crystalline lens locate. And again, in fact, more than 50% of the Americans at 80 years of age or older have cataract surgery done already. So it's a common occurrence. It's not a disease. It's, I can say, just like gray hair, just like wrinkle on your face, it's kind of like come with the package. As the machine get rusty, that is what we got. So again, cataract is typically developed through age. Now, as you look at this here, the picture, the slide that you see on the left-hand side is a moderately clouded lenses. The lenses itself, the structure is like egg white. It's made out of protein and water. And it's interesting about this is that they have no blood vessel. And then when you look at this, it's very simple. There's no cells, no other organ in there. Basically, just a uniform layer of proteins and water. It's supposed to be crystal clear. And again, with time go by, the reason is because of the fact that most of the UV light stopped by the crystalline lens because they were being absorbed by all the UV light or the radiation. With time go by, those radiation denature the structure of the protein. So it's kind of like the best way for me to say, for you to understand, is like you're putting a bowl of egg white under the sun. With time go by, what happened to the egg white is slowly they get cloudy. Slowly they cook the egg white. The same thing, UV is a radiation. As they get trapped in the crystalline lens, they denature the protein with time, and that's why with time go by, they become what you have on the right-hand side, become cloudy, just like an egg white being cooked. And so, of course, there's also other situations, other risk factor that will cause, cataract, such as, diabetes, such as, people that smoke or alcohol consumptions. And also, we have younger people that have, cataract also. Usually, it's mainly because they have some kind of eye trauma. I don't want that to happen, but again, sometimes when people get a fight and then, someone hit your face, hit your eyeball, and because of the trauma, sometimes they can also cause early develop cataract. And then family history is also another risk factor. Radiation of the head or the neck, as well as from cancer treatment, they sometimes can also cause early cataract. Just the similar thing. When you have X-ray radiation shine towards your eye, then naturally your chances of early cataract increase. Also, some medications such as corticosteroid can also lead to early developed cataract. Now, there's also one concern is for children. A lot of time it can be because of infection or can be because of the mom when they're carrying the baby, they are using certain medications, or they can be acquired in the early age. They develop some inflammation, infection. They can cause cataract. Tumor in the eye also can cause cataract in children. Now, for those situations, unfortunately, the lenses have to be removed without putting any implant in because of the age. So for those people, for those children, usually they will either have to wear contact or glasses after they remove the cataract. And later on in life, they probably were able to put an implant in when they are older. So again, this is a more serious matter for pediatric cataract. They got to discover early and get it correct so that they will not develop lazy eye or what we call amblyopia. And What are the signs and symptoms of cataract? Normally, you may not even notice, except the fact that you'll notice that increase of glare, maybe a little bit blur. You feel like there's a cloud in front of you, or you may notice that there's some smudges in front of you all the time. Those are the early signs. And of course, as time goes by, you'll notice that the color of what you see become distorted. White is becoming yellow. Color is not as vibrant, and changes of color perceptions. So all those are signs and symptoms of cataract. Now, I have cataract. What should I do? Unfortunately, there's no medication, no other treatment except surgery. Again, surgery usually is what they do is that the cataract surgeons will remove part of the lenses. They will kind of like open up the front surface of the lenses, take all the contents of the lenses out, and put a implant. This is of course, a model of the implant. You can see that the structure is kind of interesting. They have two hooks on the outside here. Those are actually springs that stabilize the lenses inside the eye. Now, as I said earlier, they only open a small opening here, so they will use an injector to put the implant inside. And the spring you can see here is holding the implant in place to replace all the lenses that you take away. Old days, 20, 30s, years ago, people after cataract surgery have to wear thick glasses, but nowadays, because of advancements of the implant, you don't need to wear glasses or contact lenses afterward. A lot of time, people can even see better than what they have before. And this is a model of an actual implant that they put in the eye. Super small, very delicate, but that's the actual size of the implant. Now, the implant technology is getting so sophisticated, sometimes you can even put bifocal power in the implant so that you don't need to wear reading glasses. What type of implant you need, you have to talk to your optometrist or talk to your surgeon to come up with the best solution for you. Now, can cataract go back after surgery? A lot of people ask this question, is it for life? Yes, implant is for life, but unfortunately, sometimes, because they only take the contents of the cataract out, the capsule that hold the implant, sometimes with time, they become opacified. That's what we call posterior capsular opacification. It occurs usually 6 months, a year, sometimes shorter on patients that have undergone cataract surgery. Now, when that happens, you don't have to go through another surgery. The surgeon will be able to use a laser called a YAG laser in the office procedure to dissolve the fibrous tissue. No pain, they do not need to touch the eye, there's no physical incision, no wound involved, and normally after the procedure that you don't even know it's done, and then the only difference is that you're able to see brighter, clearer again. So after all this information, I hope that you don't have any fear or scare about the cataract surgery. And again, remember, each year, the U.S. there's about 4 million of cataract surgery performed regularly, and most of the time they have very favorable outcome. I do not want you to have the psychological fear or obstruction or obstacle stop you from having the surgery and make you suffer from this totally correctable blindness. If you have any question, let us know. We can answer that for you and see whether your eye is ready for cataract surgery. Again, thank you for listening, and have a good day.